Hello, everyone. Chapter 9, Safety and Quality. We're going to be dealing with the medications safety standards and quality standards that have set forth. So we want to address the key points and know the meds. And as I said, just utilize all your resources. I'll try to touch on the key points in this chapter. And if you have any questions, just let me know. Of course, we've heard this before, the 5+5 rights of administration of medication. We have the rights of medication administration with the right patient, right drug, right dose, right time, right route. And so we have the right assessment, right documentation, patient's right to education, and right to refusal, patient's right to evaluation, and the patient's right to refuse here. The 5 rights of medication administration are important goals for medication safety. The nurse following these guidelines will give 1, the right patient, 2, the right drug, the right dose, via the right route, at the right time. The +5 refers to the 5 additional rights that have been recommended. 1 being the right assessment, the right documentation, the right education, the right evaluation, the right patient's right to refuse, and the right for the patient to determine is essential, because you educate that patient, and if that patient refuses to take it, you will call the physician, but they do have the right to refuse it. Now here, the right patient determination is essential. Now the Joint Commission requires 2 forms of identification before drug administration. The nurse must accurately determine the right drug to administer. When working with the EHR, once the barcode on the patient's wristband has been scanned, the patient drug profile will appear on the computer screen. So we're talking about now that it's been put into place. When you're administering medication, you'll take the computer and you'll actually use the scanner to scan the patient's armband, and then it will let you go further to help prevent medication errors. And then the nurse will scan the patient's drug profile will appear on the computer screen, and it also will alert for any medication adverse reactions or any kind of allergies to meds on that. It's basically now, instead of a paper MAR, it's an electronic MAR. And it will automatically validate the time, date, and the nurse administering the patient's medication, because you've had to sign in to the computer. If it is not correct medicine, the nurse will receive an alert. And this can happen pretty often, because you may have a medication and then you have the medication that's close in name, and so therefore this helps prevent those med errors. If it's not the correct medicine, the receive alert, and it will be unable to proceed into the MAR until the corrected medication is scanned. Not all places have the electronic MARs anymore, and so it must be verified and placed in the medical records. Nursing students cannot take phone or verbal orders. You can pay attention be next to a nurse that is, so you can encounter and learn about these things, but you have not been licensed, so you cannot do these particular things. Now, nurses are legally liable if they give a prescribed drug and the dosage is incorrect, or if the drug is contraindicated for a patient's health status. So really, with that being said, you got to know the patient. The nurse is liable for predicted effects, like post-assessment, and if the medication's been given. And if it's the first time the patient has received a medication, you actually have to monitor the patient for the prescribed amount of time because you have to make sure they have no allergic or adverse reaction. And now the right dose refers to the verification by the nurse, and the dose is amount ordered, is safe for patient to whom it's prescribed. And so we have to take all these things in consideration from the last chapter: age, weight, different type of issues health-wise, compromised renal system, compromised hepatic system. All these have to be in place. You got to know your patient and know their medical history. And you have to look at the labs and make sure they're within normal range for that particular medication. So when you have the right time, the time is prescribed dose is to be ordered and administered. Every drug cannot be given exactly when ordered. Therefore, health care agencies have policies specifies the times which the drugs to be administered before or after the appointed time. And that's normally ranges from 30 minutes to an hour. It would be considered too early, an hour too. If you administer it too early, it would be usually that hour window, and it would be considered a late dose if it's after the prescribed 1 hour after the prescribed time. Now, your 5+ rights in the medication administration, you want to know the right route. It's necessary for adequate reabsorption. The right route is ordered from the healthcare provider and indicates the mechanism by the medication enters the body. The nurse determines if the safe drug to administer according to the drug pharmacodynamics action and the patient's vital signs. Remember, your blood pressure. You don't give a blood pressure if it doesn't fall in those guidelines. And some doctors have different guidelines, so always check in with the physician. Renal hepatic functions are important considerations because of the many drugs are cleared through the kidneys and metabolized by the liver. Prior to the drug administration, it is important for the nurse to carefully review the patient's most current labs. And then the right time refers to the time that prescribed dose is ordered to be administered. Now, if it's a patient that you've just gotten on from the ER or has just been admitted, and those medications have been sent down and transmitted to the pharmacy, you can't just wait till the pharmacy sends it. You have to call the pharmacy sometimes and say, look, unless you retime this is going to be a late dose. So it won't fall on your shoulders, because if that doctor has a now dose ordered or a stat order, and you get this patient in, and it doesn't mean 2 hours later. It means as soon as you can, and you get, even if you have to walk to the pharmacy, you get that medicine. Okay, so necessary information on the medication here for responsibilities of medication administration here. This next slide. The right assessment requires collection of appropriate baseline data before administering the drug. Say, for instance, make sure you get the labs for like digitoxin. And you want to take a pulse for a full minute. And like with blood pressure or respiratory, you want to have the respirations and make sure they're even and unlabored when you're going to administer opioids or certain pain medications. Then you want to make sure before you administer insulin that is going to the blood sugar, because you don't want to bottom them out and deal with the complications that come with that. So, just remember, it's very important to remember this. The right assessment requires the collection of appropriate baseline data before administration of the drugs. You want to check the labs. You want to get the labs and vital signs for digitoxin. You want to just make sure all those different things are done. Now, the right documentation requires the nurse to immediately record the appropriate information on the drug administered. This includes the name of the drug, 2, the dose, 3, the route, 4, the time and date, and the nurse's initials and signature. Remember that, and always remember, if you're having to deal with paper MARs, you'll have are computerized. They're both the same thing. So know that information I just told you. Now, with the right to education requires the patients to receive accurate, thorough information about the drug or the medication and know that it relates to the particular condition. Patient teaching also expect side effects, drug, any dietary restrictions or requirements, skills of administration, and laboratory tests result in monitoring. Say, for instance, if you you're going to give them an opioid, hydrocodone, whatever. Anyway, it's going to slow down the bowel peristalsis. So you want to teach the patient. They want to make sure they drink plenty of water if they're not compromised with congestive heart failure or have any issue with renal, or just make sure that they take appropriate measures like Metamucil or prescribed fiber. And so you want to make sure it's important to educate on that, because if you're given the side effect and you don't want to have a patient not be informed. And I will say this too, when you're going in, I don't want to see any patient ask you what pill you're about to give me and you not have that sleeve, because I want you to take the medications in there with the sleeve on it, because you're going to catch that person, and it also helps you make sure you don't have a med error, and you will have the cup with you, the little medicine cup, and you will pop the pill out, but you will be telling the patient what you're giving them. So because they're going to ask. They want to know, what is that blue pill? Because there may be the same drug they normally take, but a different manufacturer, and put it in a blue form. So just always remember. excuse me, the nurse's right to complete a clear order and the correct drug route form, dose dispense, because if you don't document it, you didn't do it. So you will be written up for that. Right to access information, the right policies and the guideline of the safe administration, the right administration, right to administer medication safely, and to identify system problems, right to stop, think, and be vigilant when administering medications. Because with Blake Smith. Now, in addition to this, we have the American Nurses Association published a rights bill for nurses in 2015 that contains 7 premises concerning the workplace expectations and environments that nurses from across the United States recognize as necessary for safe nursing practice. And this has actually helped get the patient load down somewhat. You will never have to, maybe in the nursing home setting, but in a hospital setting, you will not see 10, 12 patients per nurse anymore, secondary to partly this right. The Bill of Rights supports nurses in the workplace situations and includes the issue such as unsafe staffing, mandatory overtime, and health and safety issues in the workplace. And so, believe it or not, things have improved tremendously. And now, medication era, you're going to see that you're going to have to be defined as any preventable event that may cause or lead to inappropriate medication use or harm to a patient. With the barcoding, it has gotten much better. And so also with the pharmacies creating labeling, different, like you'll see going on later in this lecture, like the black box, and it's in FDA is actually put that on labels on things that could be it's the strongest warning indicator. So we have ANA with safety. Supports the concept of a just culture in its position statement in 2010, and it encourages organizations to avoid using punitive approaches in reporting drug errors because they focus on punishing individuals for reporting such errors. And you'll see that with that being said, more drug errors go undocumented because the nurse had fear of repercussion of it. And so there was fatalities, and they didn't find it out unless an autopsy. It was could have been just accidental, but this helps promote more honesty and just culture. Individuals would Encourage to report drug errors so the system can be repaired and to fix the problem. A just culture does not hold individual practitioners responsible for a failing system. You have to be accountable, but they want you to report errors. Um, the people are not robots. Everyone makes mistakes, but you have to be diligent because there's different things you can do to reverse whatever things you've done. And so, although it does not tolerate or disregard for a patient or gross misconduct, most organizations have a risk management department staffed with the nurses managers, risk managers who conduct root cause analysis. And you see most hospitals now all have risk managers. Such analysis uh, presents opportunity for learning and focuses on strategy that can be put into place to correct the problem. And the key thing is the education. A lot of times you get in, you're a new nurse, you get out there, and you don't get the sufficient preceptorship. You really want to have a hospital that does back you. I have to give my hat off to UTMB in Galveston. They are all about education. I mean, most teaching hospitals are very professional in that way. They'll give you a 3-month um, preceptorship. So if depending, with LVNs, there might not be a candidate for that, but if you can find some place that you're going to start working, you want to have a preceptorship, because I would not sign anything until I had the proper in service on the way they did carried out their policies and procedures. And I don't want a book handed to me and say, okay, you're responsible to know that, but you're out on the floor tomorrow, and that just shouldn't happen. Here with if a patient dies as a result of a drug error, it is called a sentimental event. Most deaths occur from med errors. Especially, you can see it like a potassium overdose. Potassium can actually, well, that's what the Department of Corrections used for years until just recently to for execution. Now they sedate. So just to know all that. And when a prescription drug is known to be effective for some patients but cause serious side effects with others, FDA is required. It requires the drug printed material, here's that black box, to carry a warning about adverse effects surrounded by a black box. Now that's FDA's strongest warning. So I want you to know the next information I'm about to say. Drug reconciliation is an important component in the culture of safety. It's defined as the process of identifying most accurate list of medications the patient is taking, and then the transition of care, which includes the admissions, discharges from the hospital to another healthcare setting, such as a long-term care. So you want to carry an updated list, update with any type of changes, and bring to the doctors each visit. It's the FDA's responsibility to include and ensure they have accurate labeling, ensure drug is effective, ensure drug is tested for harmful side effects. But you look on table 9.2. Now that's for standard, overall standard. Once the goals. Remember about abbreviations not to use. And look at table 9.1 and 9.2. Now, safety medication administration here with sharps. Okay, you want to know the secure, responsible, disposable techniques. You have actually a responsible disposable act that encourages both public and private entities to develop secure, convenient, and responsible methods for collecting and disposing medications and controlled substances. Okay, you have dispose, say, for instance, um, certain like fentanyl patches now. You'll see some people agency do in coffee grounds at home and kitty litter, but really it should have a charcoal container to where it will absorb that, and so it cannot be reused. Then you want to always scratch through your RX bottles and not just the name. Well, that barcode tells more things than anything. So you don't want identity theft when it comes to that. You're not only safeguarding the medications, you're safeguarding your identity. The Needle Stick Safety Prevention Act, it's actually requires the employers to implement safer medical devices for the employees and provide a safe and secure workplace environment with educational opportunities and develop written policies and to help prevent sharp injuries. Because once you've been a needle stick, you have to definitely report that. Don't disregard that and say, oh, it just barely nicked the skin. You have to report it. It's an incident report. You have to go to the lab. You have to have labs drawn. The patient has to, usually be informed that it happened. So now, with sharp safety, like I said, before they have the Occupational Safety and Health Administration, OSHA, with Needle Stick Safety and Prevention Act of 2000, the consensus statement and call to action in 2002. Years past, they discouraged a person to really report it, but then AIDS and HIV came around, and there was a lot of issues. They were losing nurses, and so this way it showed that they were behind the nurses, and safety was a number one goal for the patient and the nurse. Okay, every year the United States has 1.5 preventable drug errors that occur. Data support the hospitalized patient subject to one medication administration error per day. The majority of the medication errors occur in a transaction stage. That's 56%, followed by a nurse administration stage, 41%. And then close behind is a doctor prescribing stage, is 39%. Now here you have counterfeit drugs that look like the desired drug, but may have no active ingredients, the wrong active ingredients. That was what they were finding in Mexico and Canada when people were going on the different online pharmacies thinking they were getting safer drugs, inexpensive drugs. They found out that it was basically an inactive ingredient in there. And the wrong amount of the active ingredient, improper packaging, or contamination can also be problems. You're also looking at how some drugs can be used crushed, some cannot. If they have a coating, usually you don't want to split those drugs. If you at all it's totally necessary, you might want to ask the doctor if you're having to deliver it via G-tube for alternative on the medication. Some now do not crush extended or the sustained release drugs, because this will change the pharmacokinetic phase of the drug. It will digest in the stomach and not in the small intestine, like the duodenum, where the receptor sites need to send certain signals, just the receptor for like nerve endings. There's beta, different receptors there. So just always make sure that you follow the guidelines. Now, counterfeit drugs, remember that they may look like the desired drug, and like I just said, just always, this is basically in home health where the patients have bought their medications because they're on a limited income, and it's not managing their blood pressure, or it's not managing their particular issue. You have to make sure that patient is complying with the standards, and ask them where they're getting their medications. Now, dosage forms, always consult the pharmacist and healthcare provider if reliable source regarding crushing a drug. This is just basically the same thing, saying it again, but just here, go to www.ismp.org tools on Do Not Crush, the PDF for that. Now, here with high alert medications, can cause significant harm to a patient. If a high alert medication is given in error, it can have a major effect on the patient's organs. Now, so examples here, ephedrine, that can really speed up, that's the sympathetic nervous system. Insulin, that can basically given to the wrong dose, can kill a person. It's very important to know these medications. These are very important medications to know. And you really need to be aware of medications that sound alike, like ephedrine. And then this is epinephrine. There's two different drugs. And then Amaryl and Rimonel. And this is a blood pressure, Cadopril and Carvedilol. It's a two. One's an ACE inhibitor and one's a beta blocker, or one's actually a calcium channel blocker. And then Depo-Medrol. Okay, that is a hormone, and Solomedrol is a steroid. So you want to know the difference between drugs, because there's some sound alikes that you would think it's in the same but they can be having different doses even if they're in the same family. So you always want to double check for safety. Make sure that you're creating a distraction-free environment, and be kind but firm, there, because there are some nurses and CNAs or just environmental, they'll want to talk to you, and here you are trying to do your administer your medications. And so you should really be in a distraction-free environment, and just let them know, nicely, that you have to deliver these medicines, and so you can visit later. Now, with this guidelines for medication, you want to check patient's medication, healthcare provider's order accuracy, check for allergies, prepare medications for only one patient at a time. That's really key. Calculate medications. Don't let somebody call light and then you're in the middle of giving medication to one person, like pulling up your medicines, and then say, oh, while I'm here at the or Pixis or MedCart, Omnicell, I can go ahead and pull this other medication. You're setting yourself up. Prepare medications. Let's see, calculate medications dose and perform a double check for that calculation. Now, guidelines for medication administration: always check expiration on your drug labels. I tell you what, state comes in or JCO comes in and they find any expired drugs, you always have to keep aware of what you have, because it can slip down the pike from pharmacy and you could have some medication sent to you that's expired. Rarely, but it has happened. Never leave medications unattended. Always have it in a locked med box or your med cart. Identify patients with at least 2 identifiers. Stay with the patient until medications have been taken. Never leave a bedside. Record effectiveness of results and medications administered. Now, you also want to know that the FDA replaced the lettered pregnancy categories A, B, C, D, and X on prescription drug labeling. The FDA decided that the previous letters did not effectively communicate the risk for drugs during pregnancy and lactation in females and males with reproductive potential. You now see it's been revised, but you still need to know, because you're going to have, especially in your OB rotation, the mother saying, well, can I take this medication with me nursing? You want to know how to answer that. New labeling system provides a broader explanation based on the current available information of the benefits and risks medications can have to the mother, the fetus, and the breastfeeding child. So just go over all your resources, go over these practice questions, any NCLEX related to this chapter, and you'll do well.